My name is Darla Baumgarten. I'm an associate professor at St. Ambrose University in the kinesiology department, and one of the classes I frequently teach is exercise and aging. Along with that, I bring 15 years of clinical exercise physiologist at a regional medical center where I work with a lot of different diagnoses for older individuals with their exercise programs. So I bring all of that to the picture with me as we talk about this topic. I have nothing to disclose. The statements are all there for you. So learning objectives for today. By the end of the session, I'm hoping that you'll be able to discuss the importance and benefits of exercise for the aging population, to be able to employ those principles of exercise for the older population, identify the fitness components and their relevance to the aging population, and be able to apply exercise prescription to that older population. So, importance of exercise. We need to keep in mind and remember with all the primary aging changes taking place with an older individual and secondary aging due to lifestyle factors taking place with the aging individual. There's going to be loss of muscle mass. There's going to be loss of bone density. There will be loss of cardiovascular function and pulmonary function, decrease in cognitive function and neurological communication throughout the central nervous system. So it becomes challenging for an older individual to perform their activities of daily living, possibly maintaining their independence, etc. So extremely important for the older population. American College of Sports Medicine brings up some points for the importance of exercise throughout the aging process, including maintaining health, functional ability, attenuating many physiological changes associated with the aging process. American College of Sports Medicine talked about the lower aerobic capacity, muscular weakness, and deconditioning, which is very common in older adults due to the primary aging and secondary aging factors that I mentioned. And all of these tend to contribute to the loss of independence for many individuals. Relative adaptations that related to exercise and the percentage of improvements in fitness are comparable to those of younger adults. So older adults are going to have the same physiological adaptations that a younger individual will have with the different types of fitness components incorporated. They may not be to the same extent. A younger individual is going to definitely achieve higher levels of muscular strength and higher levels of oxygen uptake, etc., but the same types of improvements are going to be seen across the board no matter what the age, no matter what the gender. So again, that's from the American College of Sports Medicine. So why exercise? Many reasons for it, but specifically for the older population, some of the goals that we're looking at would be helping them maintain or regain independence, maintain or improve quality of life, improve the functional capabilities within the limitations of the disease processes. Studies are showing that we may not be able to necessarily help individuals live longer, but we can help them live with a higher quality of life for a longer period of time with the regular exercise program. So with a larger percentage of the individuals over the age of 65 having one or more chronic disease processes already on board, it may not be so much as a reduction in the risk for actually getting a chronic disease on board, but more that of relieving some of the symptoms, delaying the processes, and making it so they're able to improve their functional capabilities within the limitations of those disease processes. So there's been a lot of research on the benefit of exercise for the older adults. American College of Sports Medicine coming back into play, talking about the benefits associated with regular exercise include but are not limited to decreased risk of hypertension, decreased risk of diabetes, high cholesterol, obesity. It can help prevent or delay of osteoporosis and less symptoms of depression and stress from a regular exercise program. Some other research out there, a study that was done in 2015 where they recruited 3,214 participants from a healthcare setting. The exercise group with this study performed a program 3 times a week for 50 to 60 minutes per session, and they incorporated cardiovascular, along with flexibility and balance exercises for over that duration of the exercise sessions. And the results show the significant mild to moderate improvement in all physical fitness components, as well as higher health-related quality of life for those individuals when they were compared to the non-exercise group. Another study done in 2015, which looked at wheelchair-bound seniors, and they had 127 older individuals, 65 years and older, with a mean age of 79, and 98% of those individuals had chronic diseases already on board with that. The study had them perform a 40-minute elastic band exercise 3 times a week for 6 months, and they found significantly improvement in the muscular strength and functional capabilities of those individuals who actually performed the exercise when they were compared to those who didn't perform the exercise sessions. And another study that was done in 2014 where they were looking at balance-specific intervention, and it was a 16-week study where they used 32, 65 to 95-year-olds, and they worked with a wobble board. And the wobble board exercises only lasted 6 minutes per training session for those 3 times a week for the 16 weeks. And the results showed a significant improvement in reducing the risk for falls. The wobble board group had a decrease in the risk for falling by 36%, where the non-exercise group showed a non-significant but slight increase in actually the risk for falls. In 2015, some researchers did a meta-analysis where they looked at 13 studies, which included 1,171 participants. The studies utilized a variety of different exercises, with the majority utilizing walking and Tai Chi as the types of exercise they used. Results of these studies indicated that physical education can benefit cognitive function among older adults who already have mild cognitive impairment, including improvements in global cognition, executive function, memory, attention, and processing speed. And physical exercise through these studies was also shown to positively impact the physiology of the aging brain. So even in older individuals, we can make a large impact on their cognitive functioning. And even those that already have a mild cognitive impairment can show improvement in those areas with a properly designed exercise program. In 2016, 36 healthy individuals aged between the 67 and 78. The researchers were looking at the intervention contributing to counteracting the age-related decline in cognitive function and improved gait. So they had one group of individuals perform just walking exercises, and the second group performed walking exercises while also doing some cognitive type activities. The cognitive things, they included things such as having to step over hurdles, swinging their arms in circles, manipulating small tools, throwing and or catching a soft ball that was thrown to them. They had them changing walking patterns, walking to time, rhythm, beats, changing directions based on a stimuli. So a large number of things where they were having to dual process just the physical component as well as some cognitive components in there. With the two groups, the gait performance improved in both, those that were just walkers and those that were combining the dual task of walking and cognitive functioning. So gait performance improved in both, but ability to carry out dual tasks only improved in the group that had the combination of the cognitive and physical components addressed in there. I'd like to point out that research has shown that physical activity and exercise can improve cognitive function, but when looking at specifically comparing the two groups together, the ones that compared the two had the larger increase than the ones that carried out the cognitive function while walking. And we had a group in 2005 that looked at the functional status of older individuals. They looked at 107 65 years and older individuals that had mental disorders, staying in a long-term stay ward in a psychiatric hospital. The majority of them had either schizophrenia or depression. And they incorporated 20 minutes of exercise in sessions including range of motion, walking, for 3 times a week for 3 months with those individuals. And they assessed functional tasks of locomotion, balance, key posture changes, as well as activities of daily living, including personal hygiene, feeding themselves, dressing themselves, bed-to-chair transfers, wheelchair mobility, or ambulation, whichever they were able to do. And they just discovered a statistically significant and clinically significant changes and improvements in the functional status of those who participated in the exercise program compared to those who did not. So again, looking at more of the cognitive aspects of it, how exercise programming, whether it's specific types of exercise or a combination, can improve an individual's cognitive function. So to move forward with it, to design an exercise program for an older individual, we need to look at the principles of exercise, and these come into play whether it's a young population or an older population. I'm going to focus on just a few that are more specific to the older population. So the principle of overload with exercise, no matter who the individual, we do need to look at trying to making sure we push the individual above what they're normally accustomed to, no matter which type of exercise we're using. We're trying to improve the function or tissue that the organ must be exposed to increased load, which it's normally not accustomed to. And then as they have the physiological adaptations from the exercise program, we need to continually to increase that overload to continue seeing the improvements with that. The principle of specificity. An individual is only going to get benefits from the training that they're doing. So if you're trying to increase muscular fitness, you need to work with muscular fitness. If you're trying to increase cardiovascular, you need to work on cardiovascular, and you need to work with the muscles that you are trying to improve those adaptations within. Then we have a few principles that are more specific to the older population. The principle of functional relevance, and with these individuals, we want to try to implement exercises that are related to activities and movements that they would be doing for their everyday activities in order to complete their activities of daily living, on the things they have to do around their house, etc. So putting together the program, you want to try as closely as possible to simulate the type of movements and the muscle groups that they would be using in order to carry out their day-to-day activities. And the principle of challenges. What this comes into play, it goes along with the overload principle, where we are trying to push them beyond what they're normally used to doing. We want to challenge them but not exceed an individual's intrinsic capabilities. The level of challenge can be altered by changing task demands or environmental demands. So we can work with the overload principle, but what we're trying to do with this one is maybe with the cardiovascular exercise, trying to change the environment that they're walking in, remembering that if they are independent or out in the community, they're going to have to be walking around groups of people, so in grocery stores and malls. So make sure they're doing some of their walking, having to go around objects, maybe walking on uneven surfaces. For muscular fitness, we want to challenge them by having them do the exercises in different body positions, things like that. So just trying to follow the principle of overload, but challenge numerous body systems at the same time. Some of the recommendations also include that's where we can add on some time, tempo type things where they're having to move to certain tempos, music, etc., or carry on a conversation while they're walking. So that's the principle of challenges. And then we have the principle of accommodation, and very specific, more so for the older population or the diseased population of any age. And that's where we have to look at the level of intensity or type of exercise. We need to adjust that based upon how that individual's feeling on that particular day at that particular time. Medication impacting how they feel, a bad night's sleep, worried about a spouse, whatever it may be, they may not be able to do the same exercise intensity or program they did the day last time they were there. We may have to adjust and back off and change. Many older individuals, they just don't feel well, and so they say, I don't feel well, I don't want to exercise. But as we start missing sessions with them, we're going to start decreasing in the accommodate or the adaptations that we see for those individuals. So we want to make sure that we accommodate how they're feeling on that day and time to make sure we keep getting them up and keep letting them be active, physical activity, exercise, etc. So we're not regressing, but that we're able to move forward as possible. So those are some of the principles that are relevant more for the older adults with exercise programming. When you start to develop an exercise program, we need to look at the fitness components that need to be included. And no matter what the age, the same fitness components across the board. Cardiovascular would be the first one. It is considered, or you'd consider cardiovascular exercise a continuous, rhythmic, large muscle group exercise. So walking, bicycling, etc. Muscular fitness, the second fitness component, and that includes a couple subcategories where we're looking at muscular strength. And muscular strength is the ability of a muscle to produce force. And we have muscular power, and that is the ability to produce force quickly. So adding some speed onto that movement. Both of those are extremely important in maintaining independence, being able to perform activities of daily living. Not every movement is done slowly, so the muscular power coming into play there, we do need to have some power on board to be able to go up a flight of stairs, to get out of a chair, those types of things. So muscular strength and muscular power, both extremely important for an older individual. Flexibility. Flexibility is a range of motion around a joint, so it's the ability of the muscles, joints, or muscles, tendons, and ligaments to stretch to accommodate the range of motion of the bones around a particular joint. And neuromotor is included for the older population with this. The previous literature used to talk about balance, etc., but the more recent studies are talking about it as far as neuromotor, which actually includes, combines the balance, agility, and proprioceptive training. So in order for somebody to maintain their balance, they're going to need to be able to maintain it when they're changing directions or body positions, so the agility and the proprioceptive training, so their sensory receptors picking up information about where the body parts are to help them then maintain their balance as well. So that would be the neuromotor component. So taking all these principles of exercise and the components of fitness, we can start looking at actually the prescription of exercise for the older population. So we utilize the term FIT formula for prescribing exercise. It can be used across all of the different components of exercise. So FIT formula basically stands for the frequency, intensity, time, and type. And as you put together an exercise program for an individual, you need to incorporate or include each of those four components into each of the types of exercise that you're going to have the participants doing. All right, so cardiovascular exercise prescription, and you start looking at that component of exercise using the FIT principle that we talked about. So we look at the frequency. Cardiovascular exercise should be performed greater than or equal to 5 days a week for moderate intensity, and 3 or more days a week if they're doing vigorous intensity. Highly recommended that they combine the moderate and the vigorous, and so then we're looking at 3 to 5 days a week of a combination of moderate and vigorous exercise. We look at the combination because most activities of daily living is going to incorporate or need the ability to do both moderate and vigorous intensity. It's not ever just a continuous intensity mode that people are working at. As far as intensity, we're looking at rating of perceived exertion, which is a subjective measurement of how hard an individual feels like they're working. We use a scale of 0 to 10. We use this because measuring of heart rate is not necessarily the best method for the older population. Some of the medications affect their ability for their heart rate to go above a certain level. Some of the contraindications of different medications coming into place. So by using the rating of perceived exertion, they're able to subjectively rate how hard it feels, and we're able to prescribe the exercise based on that. So for moderate intensity exercise, cardiovascular, we're looking at that rating of perceived exertion, 5 to 6. On a scale of 0 to 10, and 7 to 8 for a vigorous. I did want to say that there's other rating of perceived exertion scales out there. 6 to 20 is one of the more common ones, but being as many of the rating of perceived exertion scales that we use for in the hospital setting, clinical settings are on a score of 0 to 10 for pain tolerance, for dyspnea, things like that. It's easier for the older population to use that scale of 0 to 10 because they're already used to that. So again, 5 to 6 for moderate intensity, 7 to 8 for vigorous intensity. As far as time, so the duration of an exercise session for moderate intensity, we recommended 30 to 60 minutes per day or per exercise day. And vigorous, we're looking at 20 to 30 minutes per day that they're exercising on. We can look at that as far as total time in one session or accumulated time in bouts of minimum of 10 minutes. They say 10 minutes because that's where sort of the minimum level we're looking at to get physiological adaptations. But the 10 minutes can also, if an individual can't go for 10 straight minutes, we can do within that 10 minutes or that session for 10 minutes, we can do 2 sessions of 5 with a very short break in between, 3 bouts of 3.5 minutes with a very short break in between, adding up to that 10 minutes. And then slowly adding on to the 10 minutes so we're able to do the continuous of 30 to 60 or 20 to 30 minutes. And the type, as I talked about when I first introduced cardiovascular exercise, continuous, rhythmic, large muscle groups, anything that's going to get the heart rate up for an extended period of time, get the respiration up for an extended period of time. So walking, cycling, dancing, swimming, wheelchair mobility for individuals who can't be on their feet. Anything you can do that would just incorporate large muscle groups and be a continuous movement would work for cardiovascular. When we look at implementing with the cardiovascular program, you want to remember to work within the ability of the individual and what's available. As far as the individual goes, everybody's aging differently. Many of them have, or all of them have, different types of disease processes on board or history and fitness coming in at different levels. So again, you have to look at the individual and work within what their ability is based upon what they're bringing to the picture, and within what is available for you to utilize. If you're going into the home of a client and doing their exercise program with them at the home, it's going to be different than if you are at a nursing home or an assisted living facility where you may have some equipment available, but also working within the constraints of that, versus if you actually have a fitness center available that you can take your client to and work with them in that. So again, creating a program around the individual and what you have available to utilize. You want to incorporate the activities that transfer to activities of daily living, the principle of functional relevance, trying to transfer over what you're doing. So instead of just walking, you think about what they're going to have to do on a daily basis. So up and down stairs, around other obstacles, things like that, trying to incorporate that into the exercise program. There's some examples I had, the walking and doing stairs, etc. You can incorporate if they have stairs, they're probably going to be carrying things up or down the stairs, so you can incorporate carrying a basket up and down the stairs, things like that are going to help them progress with what they're having to do on a daily basis. The obstacle course, going around, stepping over, simulating if they're out in the community setting, whether just in the hallway of the place they live or whether at the grocery store, mall, etc. They will have to be moving around objects. So do your best to simulate the real world situations, carrying it over into their exercise program. And it's important to vary intensity. As I mentioned a few slides back, their daily activities aren't always going to be done at the same intensity. There's going to be varying intensity of some harder type of things they're doing, some easier. Depends on where they're walking, what they're carrying, what they're having to do. So vary the intensity throughout those sessions as well. So muscular fitness prescription. Looking at the FIT principle for looking at muscular strength, frequency should be 2 or more days per week. With important to note that 1 complete day off, so 48 hours between exercise sessions for the same muscle group. So if you're doing 4 or 5 days a week, if that's what works for the individual with shorter sessions, that's fine as long as you do the upper extremity one day and the lower extremity the next day. So the upper extremity would be getting 1 full day off, and the same with the lower extremity. So giving the same muscle groups 1 complete day off, the 48 hours, so it has time to recover, rebuild, etc. on that aspect. As As far as resistance goes, you want to choose a resistance or use a resistance that can be performed 8 to 12 repetitions. So you want them to be hitting that last repetition and be tired, but you don't want them to not be able to complete a repetition. So whatever resistance you can incorporate that's going to allow them to do 8 to 12 repetitions. For older population, we recommend not going below 8 repetitions because that resistance is a little bit high. Again, we're worried about osteoporosis, aging bones, aging joints, and we don't want to risk the injury by doing too high of a resistance. If you go above 12 repetitions, 12 to 15 is usually in there for muscular endurance as well, so that's no problem. But if you go much above that, if they're able to whip off 20 repetitions, the repetition is or the resistance is probably too low, and they're not really getting much muscular strength benefit out of that. So 8 to 12 is a good range to be looking at. As far as time, instead of looking at minutes, we're looking at total exercises that you're going to be doing. So it may take a different amount of time for different individuals, but you want to focus in on 8 to 10 exercises involving all major muscle groups, doing each exercise 1 to 3 sets of 8 to 12 repetitions. So if you're splitting it up and doing upper extremity one day and lower extremity the next day, you'd want to do 4 to 5 exercises for the upper extremity and 4 to 5 exercises for the lower extremity. So you don't have to do 8 to 10 for uppers and 8 to 10 for lowers. It's kind of splitting it up that way if that's how you're doing the programming. And type. You can do resistance exercises in so many different ways. You can use body weight of the individual. They can do chair dips off the armrests of a chair. They can do squats, just going down to a chair and coming back up, or sit to stands where they're actually sitting in a chair and standing up. They can do wall push-ups. So anything they can use their body weight on. Heel raises for their calf muscles, etc. You can incorporate resistance bands. So the elastic bands of different colors have different resistance in them, and they can do exercises with every major muscle group with resistance bands, focusing in on the full pain-free range of motion and doing the different movement patterns utilizing those. The traditional methods of free weights or weight machines, depending on the setting that you're in, you can incorporate those in. Again, focusing, making sure the resistance isn't more than they can do at least 8 repetitions for. And then my favorite, especially if you're working in the house with an individual, is household items. You can use water bottles, incorporating half full bottles to full bottles, one in each hand, doing exercises with those, or bags of dried beans, rice, etc. Or you can use, my favorite being the gallon milk jug. A full gallon milk jug with liquid in it is around 8 to 9 pounds. So you can, if they can't do 8 to 9 pounds, you fill it half full, you fill it a quarter full, however you want to do that. If they can do more than 8 to 9 pounds, you could put in dried beans, dried rice, popcorn kernels, anything you can find to help increase that resistance for the individual, and then do those exercises utilizing those. As far as muscular power, you're taking the muscular strength exercises and adding the speed onto those. So guidelines for that would include, you want to make sure that the client has the strength before you adding on the power. So make sure that they've learned how to do the strength exercises, are able to do them through a full pain-free range of motion, proper body mechanics, etc. And then you can add on the power aspect of it. So as mentioned, make sure they can perform them safely and correctly. And then when you do add on the speed for that, you want to decrease the resistance a little bit to add on the speed, the component, and that will help reduce the risk for injuries through those exercises. And then add speed only onto the concentric part where the muscle's shortening. So you don't want to have it when they're lengthening those muscles, so bicep curl when they're going back down, extending the arm. If you add speed onto that, we're risking injuring the joints. So again, just during that concentric phase of the muscle movements, when the muscle's shortened, you want to add the speed on. So with heel raises, it would be when they go up on their toes, you'd go fast, and when they come back down onto their heels, you'd go slow. Implementing the muscular fitness exercise program for the older adults. You want to incorporate movements that they're going to need for their activities of daily living. So think about what they have to do that's going to need some muscular strength or muscular power, and incorporate those movements into the exercise. So rather than just focusing on one muscle group, a bicep curl or a quadricep extension, try to incorporate numerous muscle groups into movements that they'll be doing for their daily activities. So taking things out of an oven and putting them up onto a counter, or taking things from the counter and putting them up into an overhead cabinet. So working multiple body muscles groups with the different exercises will come into play with that. Many older individuals, as their family moves out of their house and they're down to just them and their husband, etc., they start just using the working space between their waist and their shoulders. And they quit trying to use the upper cupboards except for when they absolutely have to get something out, or the lower cupboards. So they're starting to lose the strength through that range of motion, and we need to incorporate those movements back in, not just stick with what they are already thinking they need to do. We need to do the full range of motion for each of the different muscle groups and joints with that. You want to make sure they complete the movement through full pain-free range of motion. Their range of motion might be much less than a younger individual due to arthritis pain, other types of things. So you don't want to force them into a painful range of motion. So completing their muscular fitness through the full pain-free range of motion, as that strength increases, they may be able to start going further with range of motion as they start to decrease the pain in that. Vary positions. The principle of challenge is, try to have them do the exercises and activities in different types of environments, different types of body positions. So they can do them sitting, the next time they can do them standing, just to vary where the stress is going on some of those muscle groups. And you want to make sure the client breathes during their exercise. Holding their breath could increase their blood pressure dangerously. As well as it could cause them, they don't get as much oxygen, so their muscles aren't going to be working as well. So you want to make sure they're breathing during the exercise. Recommended that they breathe out during the hard part of the exercise, the push, pull, whatever that may be, and then breathe in on the easy side. But for many individuals, when we throw that in, that's going to throw them off their whole thought process, and they may not be able to do the exercise safely because they're concerned more about their breathing. So more important that they breathe than to try to breathe at the particular times. It's sometimes easier to get them to breathe out during the hard part by having them count. So count the repetitions during the hard part of the exercise. That forces them to breathe out, 1, 2, etc. And then they're breathing in on the easier part of that exercise. As far as implementing flexibility, so the next fitness component, flexibility for the older population. Frequency is 2 or more days a week. With aging, we start to lose some of the elasticity within our soft connective tissues, which includes our muscles, tendons, ligaments, etc. So that's happening on a daily basis, even overnight when they're not using them, that they'll start to lose some of that elasticity. So many older individuals need to do some flexibility every day just to help maintain that elasticity within their soft connective tissues. So 2 more days a week, but recommended the more is better. You want to stretch to the point, or have them stretch to the point of gentle tension. They shouldn't go to the point of pain. If pain is felt, you want to have them back off a little bit. You want to have them hold their stretch. If it's a static stretch, you have them hold it for 30 to 60 seconds. If it's a dynamic stretch where they're moving through a continuous range of motion, then they just perform that movement for 30 to 60 seconds. You want to focus on all major muscle groups and joints for the range of motion, and again remind them to breathe. It's not as essential as far as which part of the flexibility to stretch to breathe on, but to remember to breathe just to help them relax. As far as type, we're looking at slow, controlled movements. So if it's dynamic stretching as they move through the full range of motion, this would be like shoulder circles, arm swings, things like that. Moving to that full pain-free range of motion in a slow, controlled movement. If it's static stretching, where they're going to go down and hold a position for an amount of time, they move into the position slowly to hold that. With that and being said, with the time where they're holding for 30 to 60 seconds, many older individuals can't hold a position for that long. So having them come back up out of it at 10 seconds and then do repetitions of 10 seconds to build up to 30 to 60 seconds might be more beneficial for the older population if they're struggling to hold the position. And then the neuromuscular exercise, implementing that in for the older population. And there's no set guidelines. The American College of Sports Medicine specifies there's no specific recommendations for the FIT principle on the neuromuscular exercise. But by incorporating those exercises that combine balance, agility, proprioceptive training, has been shown to be effective in preventing falls if it's performed 2 to 3 days a week. So incorporating it into the cardiovascular component of the exercise or incorporating it into the muscular fitness component of the exercise, just so you're getting some of these exercises in 2 to 3 days a week, it has been shown to be beneficial to reduce the risk for falls. They recommend to do the principle of overload with this, just include progressively difficult postures where you're reducing the base of support, taking them from standing on 2 legs to standing on 1 with a table or a wall close by to touch if they feel like their balance is thrown off. Try to incorporate, as I mentioned, the other components of fitness together to challenge the different systems for increasing their neuromuscular fitness level. And always think safety. Make sure that you are challenging the balance, so you want to make sure that in order to challenge it, you want them to feel like they might tip over, which is why, again, you want to have them close to a counter, close to a table, a chair, something they can put their hand on just to stabilize themselves if they're needed until they get their placement of their base of support again. No matter what the component of exercise or fitness that you're doing, you need to include a warm-up or cool-down for the individuals. It's going to help them transition into safe exercise, so going from rest to exercise intensities, it's going to help them transition to that. And for the cool down, it's going to help them recover from their exercise intensity. You don't want to have them just stop exercising and go take a shower or sit down. That increases their risk for cardiovascular incidents, so we don't want that to take place. So warm up and cool down coming into play helps prevent injury, helps facilitate efficient function. It's getting the blood circulating to the muscles that are going to be working. It's increasing respiration, increasing body temperature, warming up those muscles to reduce the risk for tears, those types of things coming into play. So for both the warm up and cool down, looking at 10 minutes minimum of warm-up and 10 minutes minimum of cool-down. The more frail the individual is, the more time frame that should be put into that, just to allow that adaptation, that transition to occur. For cardiovascular exercise sessions, you want to go ahead and do the cardiovascular exercise to help warm them up. You can do some dynamic stretching movements as well, the range of motion. But simulating the exercise they're going to be doing is one of the best ways to do it, just starting at a lower intensity and gradually increasing the intensity up to what their workload is going to be. For resistance training or the muscular fitness, good to warm up with the cardiovascular exercise first to get the blood flowing to those muscle groups, help warm those up. You can also then transition over to the resistance exercises that are going to be doing and start with a light resistance to warm up those muscle groups and then add on the resistance that they're going to be doing it at. And for flexibility, the best way to get ready for increasing doing stretching is to warm up with cardiovascular exercise. Again, we want those muscle groups to have increased blood flow to them so that when the person goes to stretch then they don't tear. So warming up with cardiovascular exercise and then gently increasing range of motion as they start their stretching program for the day. So guidelines and precautions to follow with exercise programming. Keep in mind primary and secondary aging factors. We know that the aging population, they're going to be losing muscle mass just due to aging alone, and if they are sedentary, they're going to have some atrophy, the secondary aging coming into play as well. So they're losing muscle mass just due to the aging processes alone. They're losing bone density due to the aging processes alone. Cardiovascular function is decreasing. The neurological communication throughout the system, that is slowing down and decreasing some of the cognitive functions. We have to keep those types of things in mind, as well as the potential for having high blood pressure and maybe not even diagnosed. So again, the warm-ups, the cool-downs, the breathing through the exercises will all help reduce the risk for injury in any of those. So keeping those things in mind. Keeping in mind what you do know about the individual, what their strengths and weaknesses are. You want to make sure that you're addressing the weaknesses and not kind of putting them to the side because they're going to be the hardest to work on. So focusing on those but not ignoring the strengths as well, because we don't want to have those start losing and their strengths because we're focusing so much on the weaknesses. Keep in mind the disease processes the individual has, because that could affect many of the components they're doing and how their responses are going to be. the fitness level they're bringing into the exercise program, mental capacity, whether you're going to have to stand there and help them talk through each time they do a repetition or an exercise, or if they're learning the guidelines and able to do those with you just observing them. So keeping those types of things in mind. Exercise programs must take all of those into account for the individual to get the most benefit and have the most safety during it. So we know that properly designed exercise programs can maintain, can improve the functional capabilities of an individual within the limitations of their disease processes. There are some things we can't fix. Again, a large percentage of the older population are already going to have one or two chronic diseases on board. So it's gone past the preventing of those diseases. So our goal now is to limit the impact of what those diseases may bring about to them. So whether it's medication issues that research has shown that exercise can help reduce those factors, whether it's the risk for breaking bones due to osteoporosis, so we can increase the muscular strength and help with the protection of those bones. So again, keeping in mind the limitations of the disease process is coming into play. So some examples of good ways of incorporating the activities of daily living into an exercise program. If the person has stairs in their house, we know they have to go up and down stairs, but we also know that even if they don't have stairs, they're going to need to go up and down curbs to get into buildings. So incorporate stairs in there. And as I mentioned, if they do have stairs, we know they're probably going to have to carry things up and down the stairs now and then. So incorporate that into their cardiovascular program, into their muscular fitness. It can be a combination of both, so it's addressing both components during that exercise session. The milk jugs I told you about, again, you can do so much with them. Here we've got the milk jugs, and she's doing some exercise for her trapezius muscles. Fill it up with whatever you want to increase the resistance or decrease the resistance, etc. And the variety of exercises that you're able to do is pretty wide with that. Resistance bands. You can do so much with resistance bands, whether a person is able to stand up or whether they're not. The exercises can be done seated, standing. Again, remembering all of our movements are not straight forward or backwards, but we have our lateral movements. We're not just our arms, but also our legs. So focusing in on those major muscle groups with those resistance bands. Again, there's different colors, so you can vary the intensity based upon which color band you use, and progress the individuals along according to that. But these are great if they go to Florida or Arizona for the winter. They can be packed into their suitcases and not add on to that 50-pound weight limit for the suitcases on planes. Chairs or walkers or countertops you can utilize for helping with the balance. Here they're doing calf raises while holding onto the chair, so they are challenging the balance a little bit while increasing the strength of their calf muscles, but they do have the chairs to help with that. If they wanted to try to challenge their balance a little bit more, they can move down to just a couple fingertips on the chair just to start challenging the balance. But having the support of a chair or a counter or things like that can make a big impact for a person's confidence to do the exercises. Here we're showing chair with doing squats. And squats are one of the most variable exercises as far as what it carries over to do. Younger individuals, we talk about squats where they have to go down to 90 degrees at the knees and hips to get a full squat. Older individuals don't necessarily have to do full squats, just partial squats. And you can do it with a walker. You can do it holding onto a chair. When I worked in the medical center, we go down to even into ICU, and patients who were still hooked up to hoses and breathing tubes and all of that, we'd get them standing beside the bed and holding onto the walker. They could do partial squats. And that just starts strengthening those leg muscles again, because they will need those exact muscles to stand up off the bed, to stand up off a toilet seat. So it's a really good exercise to implement for any older individuals. Individuals who are independent and can come into YMC exercise programs, and doing chair sit to stands repeatedly carries over. If they do fall and have trouble getting out of a chair, they're going to need those muscles. If they happen to have an abdominal or an open heart surgery, they can't use their arms to get out of a chair. They're going to need those leg muscles. So strengthening the leg muscles ahead of time is going to help buffer the threshold before they are going to need assistance getting up and moving around. So you can do this with squats. You can do it with lunges. Again, just because a patient is in the hospital sick, it's good to keep them moving in some way, shape, or form. I put together some sources for helping you find exercise ideas for working with the older populations. I always like to remind individuals that we have a battery of tests out there, the senior fitness test being one that you're able to test their cardiovascular fitness or muscular fitness, etc. But you can go to those fitness tests and pull out parts of that and incorporate them into the actual exercise program. There are ones that are obviously beneficial for an older adult for testing them, so incorporate it into the program. There's a number of different balance tests that we utilize to determine how good someone's balance is. Great for assessing the balance, but also great to go back in and pull out specific exercises from that to incorporate into the exercise session. So again, there's a number of good resources out there. The National Institute on Aging not only has good resources for the exercises, but they have information on a wide range of the aging in general that's going on with individuals. So I recommend that you, based upon what type of place you're working at, if you're in a nursing home, a hospital, if you're working with home health care, or just with your grandparents, to find things that are appropriate for those individuals. And the individuals who are independent, living on their own, part of the goal is to increase the buffer between the threshold of needing assistance and becoming not independent and where they're at now. Because the larger that buffer is, if something happens and they get pneumonia and are in the hospital for a week, and then back home and resting for a week, they're losing their muscular strength throughout that entire time. So the more actual range they have between that threshold of becoming dependent on somebody else and where they entered that hospital stay, etc., as they lose their muscular strength, they have more chance of not reaching that threshold if they started higher. So keeping them physically active and strengthening and overloading the systems is going to help them maintain their independence for longer. I also then included the references for the studies that I talked about today, but again, go out and search for studies that are relevant and related to what it is that you've got a client that you're working with, or your interest level, or things you need to know, because the studies are becoming more and more common. It wasn't that long ago that cancer patients were told to go home and just rest while you're on chemotherapy, let the body heal. Well, now we know that doesn't work. Yes, we need to let the body heal, but we've got to keep them physically active and keep the muscular strength up and keep the cardiovascular fitness levels up so that they can continue, helps them get through the treatments as well as recover from those, for those that are the survivors. Cardiac rehab has been out there for years. Parkinson's classes have now started working with specific needs for the Parkinson's patients to help reduce risk for falls and injuries. So wide range of what we focus on for the older population. So I wish you luck as you move forward with your exercise programs for the older populations, and thank you.